Hi, good afternoon. My name is Terika Thomas Mills, and today I'll be performing the video Foley insertion for a female patient. For this video, I have my gloves. I have 2 washcloths, one containing no-rinse soap, and then I have my Foley kit here, and of course I have my patient. Alright, so I'm gonna enter the patient's room. I'm gonna introduce myself to my patient. I'm gonna have the patient identify herself. I'm gonna explain the procedure to the patient. I'm gonna get the patient's consent, and then I'm gonna go ahead and perform my skills. Knock, knock, knock. I'm going to close the door behind me for privacy. Good morning, Miss Brown. My name is Terika, and today I'm going to be your nurse. I'm going to perform hand hygiene. Miss Brown, can I see your wristband and have you identify your name and your date of birth? Just confirm your name and your date of birth for me. Okay, so Miss Brown has correctly identified herself using 2 identifiers, her name and her date of birth. All right, so the doctor has ordered that we insert a Foley catheter for you because you've been having urinary issues. So what the Foley catheter is, it's a device that's inserted directly into the bladder, and it drains the bladder of urine, like it automatically flows and it drains the bladder. Okay, is that okay with you? Okay, so Miss Brown has consented that it's okay to go ahead and perform the procedure. I've already cleaned my hands, so now I'm going to apply my gloves. All right, Miss Brown, so for this procedure, I am going to have to clean your perineal area, and I'm gonna just take a look, just like to examine to make sure that everything is okay. All right, so I'm gonna put you in a comfortable position. I'm gonna put your head down, I'm gonna lower your head, and I'm gonna raise the bed to a height that is like a comfortable height for working. Okay, so I'm gonna raise the bed. All right, so what I want you to do, Miss Brown, I want you to bend your knees, and then you're gonna point them outwards. Okay, you're gonna point your knees outwards, you're gonna keep them bent. All right, and then I'm gonna cover you. Okay, I'm gonna uncover you so I could go ahead and perform the cleaning. Okay, and then you're gonna feel me touching you down here because I'm gonna have to clean you, so you're gonna feel me touching you down here. Okay, so I'm gonna take my first washcloth, and I'm standing on Miss Brown's right side. I'm on the right side of the bed because I'm right-handed, so I'm standing on the right side of the bed for this procedure. Okay, so I take my washcloth that contains the non-rinse soap, and I'm gonna go ahead, I'm gonna clean. Miss Brown, you're gonna feel me touching you down here. Okay, so I'm gonna clean from top to bottom, and I'm gonna clean the side that's farthest away from me first, top to bottom. I'm gonna fold to get another clean area. I'm gonna clean the side that's closest to me, top to bottom. I'm gonna fold it again, and then I'm gonna clean the center from top to bottom just the same, and I'm gonna discard. I'm gonna take the other dry one, the other clean one, and I'm gonna dry you, Miss Brown, just as I did with the washing. The side that's farthest away from me, the side that's closer to me, and then I'm gonna dry down the center. Okay, so I'm gonna examine you a bit, Miss Brown, just to see if there's any discharge, any odor, anything that looks like out of the ordinary, anything that doesn't look normal. And I'm also gonna try to identify the urinary meatus. Okay, so I have identified the urinary meatus. I have examined her and everything looks okay. So now I'm going to go ahead, I'm going to remove my glove. All right, and then I'm going to perform hand hygiene. All right, so Miss Brown, now that we have completed the first aspect of the Foley insertion, I'm going to go ahead now and then I'm going to get my sterile kit and I'm going to place my supplies. I want you to continue to keep your legs ajar, keep your legs open. I'm going to place my supplies in between your legs. Just try to ensure that you don't touch anything. It's a sterile procedure, so we want to make sure that sterility is maintained, okay? So you're going to keep your legs open. I'm going to take my kit. This bag, I'm going to put it at your side. I'm going to be using it for the trash, okay? Ensure you keep your legs open. I'm gonna open my my sterile kit one flap at a time, just holding on like to the outer margin. One. I'm gonna open this side. I'm gonna open the other side, and then the side that's closest to me, I'm gonna open that last. Okay. Okay, so all right, so I'm gonna take my glove. I'm gonna apply my glove. Let me just move this over a little bit. Okay, so I have cleaned my hand. I'm gonna apply my sterile glove. Okay. Still gonna move this. Okay, this should be fine. Just hold it on to the 1 inch margin. Alright, I'm gonna move this over a little bit more, that way nothing is touching. I'm gonna still hold on to the 1 inch margin. I'm gonna move it over a little bit. All right, so now because I've touched it, I'm gonna go ahead and I'm gonna clean my hands again. Okay, so I've cleaned my hands, I've sterilized my hands, sanitized my hands. So now I'm gonna go ahead, I'm gonna apply my sterile glove. I'm gonna glove my dominant hand first, which is my right hand. I'm gonna use 2 fingers. I'm gonna pick up my glove. Okay, so I'm gonna take my 4 fingers. I'm gonna put it under here and then I'm gonna apply this glove. Okay, so I've applied both gloves. All right, so this I'm done with. So I'm gonna move this over, move it out of the way. And now I could bring this closer in reach of the camera. All right, so now Miss Brown, what I'm gonna do, I'm gonna drape under you and then I'm gonna apply a second drape to your perineal area, okay? So I'm gonna take this first one. Can you raise your hips up a little bit for me, Miss Brown, so I could put this under you? Okay, so I have draped her under here. I'm gonna take the second one and then I'm gonna drape her perineal area. I'm gonna cover her. Okay. All right, so I'm gonna take my supplies and then I'm gonna set them up on top of the lid here. I'm gonna open everything and make sure that everything is within reach. So I'm gonna take my cotton swabs, and this is open due to practice. I'm gonna take my 3 cotton swabs and then I'm gonna place them on top of here. I'm gonna set that aside, and then I'm gonna take my lube. Okay, and then I am gonna take my pre-filled syringe that contains 10 cc of Aquaflate. I'm gonna take the top off, and then I'm gonna attach it to the balloon port that's on the catheter tubing. I'm gonna put it here, and then I'm gonna rest it here for right now. So I'm gonna take this, and then I am gonna put it in the lubricant, and then I am gonna lubricate the tip of it, like 2 to 3 inches of the tip. I'm gonna lubricate. Okay. All right, Miss Brown, so what's gonna happen, I am gonna ask you, before I begin, I'm gonna have to clean you again. Okay, I'm gonna be spreading your labia, and I'm gonna be cleaning you, and try to see if I could visualize your meatus. Okay, so I'm gonna use these alcohol swabs. They're gonna feel a little bit cold, so just bear that in mind. And if at any time you feel any form of discomfort, you just let me know. Okay, so I'm gonna be touching you down here again. Okay, so like I did the first time around, I'm gonna clean the side that's farthest away from me. I'm gonna be spreading the labia. Clean the side that's farthest away from me, top to bottom. I'm gonna dispose. I'm gonna take the second one. I'm gonna clean the side closest to me, top to bottom, and then I'm gonna dispose. I am gonna take the third one. I'm gonna clean down the center, top to bottom, and I dispose. Okay. All right, so now that I've cleaned you, Miss Brown, I am gonna go ahead and I'm gonna take the Foley, and then I want you to take a deep breath, and then when you take the deep breath, I'm gonna ask you, when you exhale, that's when I'm gonna insert the Foley. Okay, so go ahead and you're gonna take a deep breath. Okay, so I'm holding the Foley 2 to 3 inches from the lubricated tip. All right, so go ahead and take a deep breath for me, Miss Brown. Okay, so I'm inserting. All right, so I've inserted the Foley, and I've noticed there is some urine flow. So I'm gonna go ahead and I'm gonna advance it for another 2 inches. I'm gonna hold here with my 2 fingers, and then to ensure that I'm stabilizing the catheter at the meatus, and then I'm gonna take the syringe and I'm gonna inflate the balloon. I'm gonna use the entire content, the 10 cc of Aquaflate that's inside the syringe, and I'm gonna inflate the balloon. Okay. Okay, so now that the syringe is empty, I'm gonna remove it. Okay, I'm gonna pull gently on the catheter to see if there's any resistance. All right, so I sense some resistance, which means that the balloon is completely inflated. Okay, So I am gonna have to clean you up one last time, okay, Miss Brown? So I'm gonna remove this. And then I'm gonna clean you up. Okay, I'm gonna discard this. Okay, and then all these supplies that I no longer need, I'm gonna get rid of all of these. I'm gonna discard them. Okay, so I have discarded my supplies. So now I'm gonna go ahead, Miss Brown, and I'm gonna attach the Foley catheter. I'm gonna attach it to your inner thigh. I'm gonna use, for now, I'm just gonna use some tape as a form of securement device, and then I'm gonna attach it to your inner thigh, okay? Okay, I have attached that, and then I'm gonna hang the bag on the side of the bed below you, okay? When attaching the catheter to the patient's inner thigh, you want to make sure that there's enough room, just in case the patient has to move or do anything. Then there's no tugging, there's no pulling, there's enough room that allows for comfortable movement. Also, for the bag, you want to ensure that there's enough cord, that there's enough tubing. Same reason, just in case the patient has to move, then there's no tugging, okay? How do you feel, Miss Brown? Okay, so now that I have attached the bag in a secure position, I'm gonna remove my glove. I'm gonna perform hand hygiene. And then I'm gonna return the patient to a comfortable position. Miss Brown, I'm gonna raise your head. And then I'm gonna lower the bed. And you could go ahead and stretch your legs out. You no longer need to bend your knees. You could stretch your feet out. And then I'm gonna cover you. How are you feeling? You're feeling okay? All right, so do you have any questions for me, any concerns? No? All right, so just few minor instructions, Miss Brown. Just in case you want to move, you have to get up out of the bed. Try to see if you could ring the bell for assistance so someone can come and help. Maybe to remove the bag, the Foley bag, from the side of the bed, just to assist you. And if you have to move in the bed, try to ensure that you're not tugging on the Foley. Try to ensure that you're not tugging on it, because you don't want it to get dislocated, or you don't want to hurt yourself during the process. So ensure that you're not tugging on the tubing, okay? All right, so I'm gonna cover you. Are you comfortable? Okay, so any questions, any concerns? All right, so since you have no questions or no concerns, I'm gonna go document, okay? So I'm gonna leave the patient's room. I'm gonna close the door behind me for privacy, and I'm gonna go document.